Remember, there were two different sets of exercises in the study. Because there was no difference between the benefits of these two sets of techniques, we'll describe and demonstrate both the reduced breathing exercises and the physical movement exercises. You could choose to use either of these to see if they can help to control your asthma symptoms. With the help of Professor Christine Jenkins and Cassie was the PhD student who undertook the study for CRC, we'll demonstrate two sets of exercises in each group. One set for practicing daily, the routine daily exercises, and one set for the relief of symptoms, reliever techniques. The reduced breathing exercises have 5 components: gentle breathing, awareness of reduced breath, breathing check, relaxed breathing, and extended delay.
Up until now, you may not have paid much attention to the way that you breathe, as it happens automatically. Cassie will now join us to demonstrate these exercises. From now on, when you are breathing, try to keep the following 3 things in mind. First, remember your posture. Sit upright with your feet on the ground and legs uncrossed. Second, remember to relax. Keep your chest and tummy muscles relaxed while you are breathing. Third, maintain focus by looking up or closing your eyes. Now let's try combining these factors that help our breathing. Think about posture. Relax. And focus. You should feel that it is easier to breathe now, but you should not feel as though you are making a conscious effort to breathe more slowly. This is not what we want. Now that you are feeling relaxed, close your eyes or look up. How do you feel? Let's put these factors into use. Gentle breathing. Sit upright on a firm chair with your hands in your lap, your feet on the floor, legs uncrossed. Relax your shoulders and your chest and tummy muscles without slouching. Breathe gently through your nose. You shouldn't feel as though you're deliberately changing your breathing in any way. We call this gentle breathing. Now for breathing check. In order to see if your breathing needs correction and to monitor your progress while doing these exercises, we need to be able to check our breathing. To be able to do this, all you need is a watch with a second hand. Continue breathing through your nose in a relaxed and gentle way. I'm going to ask you not to breathe after exhaling. Don't breathe out in a forceful way. Practically straight away, you may feel as though you need to breathe in again. Take no notice of this feeling. The sensation that you're experiencing is called awareness of reduced breath, which is what we want to achieve. I want you to keep waiting until you feel as though there is no air in your lungs. Then return to gentle breathing. You shouldn't feel a sensation of discomfort. When you return to your breathing, you should not feel as though you need to take a big breath in. The breathing check allows us to measure in seconds the amount of time between you stopping breathing and the time that you start again. Let's try it together now. Breathe gently. Take a breath in through your nose and breathe gently out. Then hold your nose. Now don't breathe again until you feel awareness of reduced breath. Good. Now release your nose. At first, learning the breathing check may seem a little tricky. The most common errors with this method are firstly, taking a big breath in before starting. Remember, the breathing check begins from gentle breathing. The other mistake is that it is easy to make is trying to hold on for too long, which makes you feel really out of breath afterwards, and you may feel as though you need to take several deep breaths. If this happens, do not hold on for as long next time. So let's try it again together. Breathe gently. Take a breath in through your nose. Breathe out gently. Now hold your nose. Okay, start breathing gently again after you experience awareness of reduced breath. Remember that the breathing check helps us to see how our breathing is improving. If you are having difficulty achieving awareness of reduced breath, you can try to decrease the amount of air just slightly that you're taking in with each breath. Another technique to reach awareness of reduced breath is to pause after a gentle exhalation until you achieve this feeling. Then start your gentle breathing again without taking deeper breaths so that you maintain the feeling of reduced air. We have now learned 3 components of the breathing exercises: gentle breathing, awareness of reduced breath, and the breathing check. Let's move on to relaxed breathing. By doing these exercises, we want to correct our breathing pattern by re-educating our bodies to breathe in a different way. This involves maintaining the awareness of reduced breath. Maintaining this feeling for substantial periods of time is called relaxed breathing and is the basis of progress in these breathing exercises. So, how can you achieve relaxed breathing? Breathe through your nose. To make sure you are doing this, keep your mouth closed. Remember your posture. Sit upright, with your feet on the ground and legs uncrossed. Remember to relax. Keep chest and tummy muscles relaxed while you are breathing. Maintain focus by looking up or closing your eyes. Maintain the awareness of reduced breath. Good. Now we're going to learn about the final exercise, the extended delay. This technique may help you to gain rapid control of your breathing if for any reason you feel as though you are losing control. The extended delay starts out in the same way as the breathing check, from gentle breathing. Breathe in, then breathe out normally. Now hold your breath out. Like when you do the breathing check, you will feel as though you want to take a breath in, but don't do this. You need to keep holding. You are aiming to hold your breath out for as long as you can. When you start to breathe again, try to stop yourself from gasping for air. What we want to do at the end is take several short breaths through our noses rather than deeper ones, as this will help us to stay in control of our relaxed breathing pattern. When you first try the maximum delay, it is easy to try and hold your breath for too long. A sign that you've held on for too long is that you feel the need to gasp for air by opening your mouth. You need to be able to keep your mouth closed and stay in control of your relaxed breathing. We also want to avoid hyperventilating.
As you can see, the main difference between the extended delay and the breathing check is that as soon as you become aware of reduced breath in the breathing check, you return to gentle breathing. Now, in contrast, in the extended delay, you need to maintain this feeling until you feel a stronger sensation of reduced breath. It's recommended that if you do not feel comfortable or confident practicing the extended delay, that you avoid it altogether. You should only ever do the extended delay if you lose control of your breathing.
Congratulations! You have now learned all of the components of the reduced breathing exercise. To practice and perfect this technique, we advise you to do your exercises twice a day and whenever you have asthma symptoms. Initially, you'll probably need to watch this demonstration once a day. In the study, we recommended that these exercises were done first thing in the morning and last thing before going to bed at night. However, you can practice your relaxed breathing at any time, no matter where you are, such as in the car, on the bus, standing in a lift, and so on.